acupuncture, muscle puncture, dry needling, intramuscular stimulation. All of these terms are used for the same type of treatment, which is taking a super tiny needle like such and using it to stimulate the body in order to trigger or facilitate recovery. My aim of this video is to shed some light on what is acupuncture, what are the different styles, how is Eastern different than Western, does it hurt, is it effective, is it safe, and so on. So at the end of the video you'll have an answer to all of these things. Let's start with the first question. So what is acupuncture and how is Eastern acupuncture, Chinese acupuncture, different from Western acupuncture or dry needling? Now, by definition, if you take a look at the word acupuncture, it's made of two words, acu, which means the skin, and puncture, which means to go through or to penetrate. So by definition, anything that involves a needle going through the skin would count as acupuncture. But there are some differences. The Eastern way focuses on something called meridians, which are these pathways through the body that carry energy, also known as qi. The idea is, and this is a simplified explanation, the idea is that when we can find blockages of that qi flow and we can insert those blockages with a needle, energy flow can reoccur and therefore recovery can take place. Western medicine doesn't really work with or acknowledge meridians because you can't really see them, you can't visualize them, so we don't really work with them. Instead, we focus on muscles and so-called sort of knots or trigger points, whatever you want to call them, tender points in the muscle that are either tender when pressed and or can give referred sensations. A good example is the muscles over here, very well known to give headaches in sort of the temple area. So what we then do is find those points, manipulate them with a needle, and we can reduce the muscle tension. So it's a much more muscular and a much more mechanical approach versus the more energetic approach of the Chinese traditional way of doing acupuncture. From my personal experience, we use acupuncture for two different types of issues. And one is mechanical. So let's say you have an office job, just to give you an example, and you're constantly sitting in a position where you ask certain muscles to do a lot of work. That can lead to overuse. It can lead to issues where you create these sort of micro cramps in the muscle that we call knots or trigger points, and eventually they can lead to painful and stiff muscles. They can cause limitations and stiffness when you're trying to move. They can change your posture, and they can also eventually cause secondary symptoms like headaches. So the first treatment option that we use it for is to find and reduce or eliminate those points out of your muscle, and therefore hopefully also affect the symptoms. Number two is more of a holistic approach. So we found that acupuncture has a very strong, significant effect on the central nervous system. So if you've ever been treated with acupuncture, you'll probably notice that you generally feel very relaxed, very tired. Many clients take a long nap after they get treated with acupuncture. So there's a very profound effect on the central nervous system that causes an overall relaxation. Many practitioners leave the needles in for a prolonged period of time to further add on to this effect. So we leave the needles in, somebody stays on the treatment table for 25 minutes, sometimes all the way up to 45 minutes. Many people fall asleep, and you can imagine what kind of additional relaxation effect that has on you. Even though it may seem scary to have needles put in your body, generally acupuncture treatment is very safe, and there's a couple of reasons for that. First off, all the needles should be pre-packaged and completely sterile, and we only use them once. There are places that use needles multiple times. If that's the case, they should have equipment to fully clean the needles. My personal preference is using one-time needles. Then secondary, the practitioner should take time to clean the skin, clean the hands, wear gloves preferably. If you take all of those things into account, which I consider normal protocol, then you don't have to worry about any type of concerns or infection, anything like that. Now, if you are a certified practitioner, you should also know which areas you can needle and which areas you should stay away from, which direction you can needle, and you should be able to explain that to your client as well. There are a couple of areas that we typically do not needle, and one would be close to the neck and the top of the lung. You might not be surprised for that. Now, that doesn't mean you cannot needle in this area, but you have to be careful. You have to make sure that you stay away from certain structures. There are techniques for that, but in general, we consider those a little bit more high-risk areas. Other areas might be the lower part of the abdominals where we have the intestines. Again, those areas are possible to needle, but you need to be very specific with your type of needle and your needle direction. Other than those sort of areas, the arms, shoulders, neck, spine, face, all very safe, and the practitioner should know where most of the big nerves and arteries are, should be able to feel those, block them, and you'll find that some of the practitioners will actually illustrate where they are on the skin before they go into their needle practice. Now, from my point of view and my experience, once you explain that to the client and visualize them, that takes a lot of the concerns away. So overall, a very effective, very safe treatment method. And of course, the question very often, is it painful? I would say it's very difficult to describe and label it as pain. I personally do not find needling painful, especially if you compare it to getting a strong massage. Somebody pushing an elbow down into your muscle, I think, is a lot more painful than having a 0.2 millimeter needle kind of traveling through the muscle fibers. Now, you might be able to imagine, if you have a deep muscle problem, having a super small needle versus having somebody press down hard and maybe having to go through multiple layers of muscle, this is not painful compared to having a strong massage like that. So from my point of view, no. Also, it's important to note that these needles are not comparable to the needles that we use for injection or to draw blood. Those needles are bigger because we need fluid to go through, and they are also sharp. Believe it or not, acupuncture needles are blunt. But because they're so small, it doesn't matter. But the benefit is they don't damage anything. They don't damage any muscle tissue. They don't damage any blood vessels. Very rarely that you get one little red tear, but that's about it. That's of course because these are designed not to cause any damage. The injection needles are designed to open up blood vessels so that you can take blood out of it. So much less painful, should not be compared to a traditional injection. And that's pretty much what I have for you in this video. I hope this video cleared up any questions or concerns that you might have about acupuncture treatment. If not, feel free to leave a comment, a question, or reach out to me personally. And you can, of course, contact me if you need any treatment, you have any additional questions. Okay, I'll see you at the next video. Bye.